Hi, this is Eric Ruderman from Northwestern in Chicago. I'm coming to you from the EULAR meeting in Barcelona for Room Now. And I wanted to talk about some issues I've been seeing relative to psoriatic arthritis at this meeting. One of the first is that there are a lot of abstracts and discussion about difficult to treat psoriatic arthritis. I think this mirrors a lot of what's being done in rheumatoid arthritis right now, as well as some work in axial spondyloarthritis. And the issue has been that there are patients who just don't respond to therapy, and there are efforts going on to try to identify exactly who those people are, to try to clarify them so that they can be considered for specific clinical trials, and also to try to understand that issue so that it helps us make treatment decisions. In psoriatic arthritis, it's been very intriguing. The issue is that there are patients who um, have been difficult to treat in that they've had challenges responding to therapies. Typically, the most common delineator is failure of two biologics or two targeted synthetic DMARDs. And there's data being presented at this meeting, or at least recommendations from EULAR. There's also a paper from GRAPPA, but a number of discussions on this. And I think the really interesting feature, and one of the things that the psoriatic arthritis folks who are looking into this are doing, is trying to differentiate between people who are difficult to treat because they have refractory disease. Their inflammatory disease is refractory, and those who are difficult to treat because they have other management issues. Either they have central pain, they have some tolerability issues. There are other factors that go into the reason that they are not doing well on their current therapy. One of the things that's coming up this meeting is trying to really define those two subgroups, and it looks like roughly 10 to maybe a little higher percentage of patients are difficult to treat, in which in that they're not responding to a couple of different targeted therapies. But of that group, it looks like about a third are sort of complex to manage or difficult to manage. And the interesting thing is that that terminology has been a big discussion, that within GRAPPA, that's been called complex to manage. Within EULAR, they're calling it difficult to manage. And I think there's some effort afoot to try to harmonize those. But the issue there is there are patients who aren't responding, and some of that is central pain or fibromyalgia, if you will, in some cases. And so that switching their biologic DMARD isn't going to make them any better. And then there are patients who are just not responding to their biologics, and that's important because we have to find what the right drug is for that person. And there's some interest from pharma companies in trying to look at that. Um, there are no answers yet, but I think it's really been an interesting discussion, and it's something that's coming up and being talked about a lot at this meeting. And as I said, it's being talked about not just in psoriatic arthritis, but in axial spondyloarthritis and in rheumatoid arthritis. And I think it's one of the next areas that we're really looking at in rheumatology to try to identify those patients. We're always talking about sort of unmet needs, and this may be an unmet need, and it may not be an unmet need for a new drug. It may be just trying to understand those patients better so that we can use the drugs we have better, or decide when maybe it's not appropriate to switch drugs, but to think about other ways of managing pain besides another biologic. So stay tuned. I think there's a lot of work in this area, and I think we'll see more over the next few meetings. But it's going to be really important to help us understand how to manage those patients who are just a challenge for all of us as clinicians. Anyhow, I'm coming to you again from EULAR here in Barcelona, and this is Eric Ruderman for Room Now.